नहीं तो रहो आरपी में. Oh, is another gem of our. He has done how many courses in acupuncture? I also do not know. He is a ENT onco-surgeon. Ravi Vasava Reddy.
Happy to see you, sir, today.
My best friend and one of the finest acupuncturists I have ever seen. He left his ENT surgery just to practice, and I don't know how he works. He takes a pendulum and decides this medicine will work or not. I always think it is quackery, right? As you people think percutaneous needling is quackery, I think his method is quackery, but I often found it is right. How did I test? I also know homeopathy. I said, Anika 30, 1 m, 10 m. I gave it. Without naming, placebo. One placebo. I told him, with this pendulum, can you find out which is Anika 1 m? He went to 30. Out of 4, he found out which is Anika 1 m. I realized he is not full. Because he has done 2 DNBs. He is a MCH ENT surgeon. Understood? Why we become expert? Because our group is an expert group. All Mohan Singh, retired professor from Manipal Hospital. In his time, anesthesia department was the best department in India. In Manipal. He is now 75. Don't tell him he's everything. He looks like 55. Original age 75. I never tell him. He's very happy if you tell him 55. आप तो 55-50 के लगते हैं. You are 50 years. बस इतना ही होगा. And I tell you, in between his case discussions, take out the formulas. It taught me so many things. Now, recovering spinal cord injury, this is what for me, what you know. Just a cup of tea. And pain management, before you drink half of your tea, the pain is gone. Before you ask, how is your pain? The pain should go. And I'll teach you techniques with stopwatch. In how many seconds the pain can go. You will forget using these medicines. I'll talk you in seconds. Not seconds, microseconds. But this is a very important case. So, since you are a physician, you may please read out the story and you may please explain the complication of this patient. Keratoplasty was advised 3 months, we did it in 1 month. He came in keratotomy to me. They told they will do keratoplasty after 4 months. Because of cleaning and cooling system, I got it done urgently. तो बाकी ठीक है, वो एमआरआई बता दो. वो एमआरआई को समझा दो इनको ये क्या है.
His CT scan of brain was performed on 16 July 2021. So at that time he was a known case of left capsuloganglionic hematoma with perifocal edema. Means capsuloganglionic hematoma means he had a massive bleeding, internal bleeding in the brain, with a massive edema of the brain of that side, due to which this problem has developed.
So,
And he had a left frontotemporoparital craniectomital defect noted with mild overlying soft tissue changes. Means what he is operated, those changes have occurred in the brain after surgery. So that is written over here. But the main is known post-operative follow-up CT head study was done. So it has come
So can this person speak?
very difficult because it's such a huge
Hematoma, right?
hematoma. Yes.
Give me 3-4 needles.
Translate ಆಗುಂಟದ ಎದುರು
How many years condition? How many years this condition? 6 years. Since 6 years, you have this problem. 6 months only. Sorry,
This case, a total autistic child will just change by 10%. They just trying to make our walk.
మళ్ళీ
Now you tell me what is the use of MPT? Do BPT, take your license and practice like a what professor. You are known for your practice, not for your degrees. Do you see I had any degree after my name? Huh? Did you ever see writing prefix before my name? Or don't I get respect of doctors to doctors? Respect knowledge. And don't have dilemma. Those who have dilemmas and those who don't have savings, please don't come to this field. The field only belongs to those people who really wants to what? Solve the cases. Fight the war. Mean it. Right? Sir, according to you, what should be? Can you sing like a singer?
You will not be able to talk. There is no question of
Large
singing.
cannot tickets to me was
How
done.
will you listen, sir?
Okay, give me few needles. Sir, if he sings, then what will you give me?
I teach you one more stem cell therapy technique. Top secret one, top secret.
You see, I asked Kaka Subbarao, he asked me what you want to ask me. Sir, I want to become a better physician. He showed my eye and he said, create seminar and workshop every month. Huh? You'll become a better physician every month. I don't need to go anywhere to learn anything. You know why? Everyone comes here, I broadcast my videos. All good people will automatically come, will teach me everything and what? See how I stimulate these areas. Remember one big pain. On one clear, I want more clarity in his song. Right? पड़ा वाला नीडल और पेन देना स्टिमुलेट कर दो तुम
I think it's a long needles. Yeah. This one, sir? This one?
स्टिमुलेट करो आज तक मैं इनको बोलता था इसको आई शुड टीच हिम बीबी, तो यूज टू से वाइफ होमो गे, दिस वाज हिज डेफिनेशन. I always used to say BB means what? You did not hear what I said. B. I did not say BB. BB means what? Blood brain barrier. How to cross that blood brain barrier? So only when you give homeopathic dose of allopathic medicine with normal saline.
Less than 50
Delta. And patient should get what? Instant on the table you should get recovery. If it does not get recovery on the table, you are failed. See, how to bring voice in a person. Mukhuri. How to recover speech aphasia. अब सुनो, आप अपना गाना गा के देख लो और फिर इसका गाना देख लो, दोनों में से बेटर सिंगर कौन है अभी पता चल जाएगा. ओके, वो अमंग्स यू कैन सिंग, कौन गाना गा सकता है? ए, तुम्हें गाना आता है? फिल्मी गाना? हाँ, ओके, विल सी. यस,
अभी नहीं आएगा.
मैं रुको तो कुछ तो गाना आता होगा.
You can try at least.
हाँ. And then we'll see who is singing with what rhythm and pitch and expression. In sing there are three things: pitch, rhythm and
Expression.
हाँ. 1 minute. अब तुम गाना गाओ, कोई भी गाना गाओ, पुराना वाला. पहाड़ों फूल पर गाओ, आता है? हाँ गाओ.
Continue.
बरसाओ, मेरा महबूब आया है, मेरा महबूब आया है.
तो सर,
महाराज बता मेरा मन को बुलाया है, मेरा मन को बुलाया है. औलादी तुम कम देवी के
he is having some pronunciation difficulty. ये तनका ये आइडिया को स्टिमुलेट करो. You see how you divide the Varniki, dead Varniki idea.
The frenum you are stimulating, sir?
Ah, no, we are going to the hypoglossal nerve.
Oh,
You know, my father was telling a story when he went to Himalaya, in that Kailash, he became hypo, his SPO came down,
okay.
situation fell down. He did not understood Chinese, so he had one hydrocortisone. Immediately he took sublingual and it immediately affected. From there I understood the power of sublingual. I started doing many procedures from sublingual. And sublingual can act so fast, better than the intravenous.
Yes.
Then, अब कांचा रे कांचे गाओ. No 1 minute. You know this song? हाँ, थोड़ा सा गाओ.
Take line.
कांचा रे कांचे रे.
पीती मेरी कांची दादा छोड़ के ओ कांची रे पीती मेरी सांसी दादा छोड़ के.
Better than before the pronunciation.
छोड़ के में again is making a mistake. So stimulate. यहाँ है. एक अंग्रेजी है. How to correct each word?
उल्टा कीजिए.
स्पीच थेरेपिस्ट करते हैं ना, इससे तो बहुत है.
अरे स्पीच थेरेपी, मैं दुनिया भर की स्पीच थेरेपी करता रहता हूँ यहाँ. मैं ऑल इन वन हूँ. मैं मरवाड़ी आदमी एक पहचाना दो स्पीच थेरेपिस्ट को. तुम खाती नहीं हो बेटा, तुम अपने पैसे सबको लुटाते रहते हो. आसाम मैं तो वो थाईलैंड में जाके वो न्यूरो सर्जन के साथ वो अवोमिनेशन बना के आ गया.
लोकली आपका रखा
पीती मेरी साथी टोल के कांते रे पीती मेरी साथी टोल के चूरा है ये मेरा नाता नहीं नाता नहीं पापत न आमंगा माच चला जाऊंगा मेरी चोर के याद मेरे खाता
Now you see that it's moving of the tongue. How to understand how his tongue is moving in all direction? His son was talking to me regularly. He said his father used to hear old songs. So from that process, zero voice to this process, I understood how to train his tongue. And how much tongue is trained with my stimulation. I learned some old film songs whenever I got time. Well, because I sleep at 2, I don't have any interest in singing. But just because of him, I learned some songs. So I knew these 3-4 songs because I have not seen television for 30 years. So I know only 30-year-old song. So one of the song I learned to see the moment of his song is Murmur ke na dekh murmur ke. So you sing this? Let us see.
मुड़मुड़ के ना देख मुड़मुड़ के मुड़मुड़ के ना देख मुड़मुड़ के.
Now you sing.
मन मन गना बोल के मन मन ना थे बोल के नदी दाना दाना ना ना
बेटा यहाँ में इसको यहाँ में ट्रबल आ रहा है देखो. ना ये कौन नहीं यहाँ ये मसल फेशियल मसल का साथ नहीं दे रहा. फेशियल मसल को ट्राइजेमिनल नर्व को इंस्ट्रूमेंट को इंटरनली ट्राइजेमिनल नर्व हाँ स्टिमुलेट द गैंग्लियन ऑफ द ट्राइजेमिनल नर्व. हाँ सीधा नीडल ले जाओ यहाँ अंदर से. हाँ ऐसे ले जाओ यहाँ एंड पार्ट पे 3 जगह पास वहाँ स्टिमुलेट कर दो.
ये एरिया है ना सर पूरा.
हाँ
टीएमजे बिगल एंड ऑफ टीथ जाड़ मैंडिबल जॉइंट पे.
आप तुम समझ लो तुम्हारा सेमिनार इसलिए बेस्ट है क्योंकि तुम्हारे पास ENT सर्जन, ऑर्थोपेडिक सर्जन, न्यूरो एंड कार्डियोगाइनोसियोलॉजिस्ट है. दिस डेडली कॉम्बिनेशन यू कैन नॉट हैव एनीवेयर इन द world.
I have not seen this combination in our workshops. So this is the first time we are seeing it. So one more ENT surgeon from Salem.
Oh, who is that?
Sir, here, sir.
Oh, I never know him. You know me. My attitude. After you say I'm an ENT surgeon, then only I will take interest. Oh, what do you know? My thing is, see, this physiotherapist and all, I don't take much interest. You know why? I call them Mela. They come here, see the dance, and they go away. But they are the physicians who continue the work. If you ask Dr. Orthopedic Surgeon, he will continue to practice. Understood? But most of the physicians who come to me, they just see the magic, express very good comment, forget about expressing also. At the end of the day, they create one drama here. They speak very good words about me, which you will also not like to hear. And then what do we decide, you know? Why do we teach? But then sometimes you get good people. Who? Orthopedic surgeon. E. Mohan Singh. Now you see our combo. पूरा cocktail है. पूरा एकदम रॉयल सिल्यूट से भी बढ़िया कॉकटेल है, पी के देखो। अब देखो उसको मुनमुन के ना दे।
मुनमुन के ना दे एक मुनमुन के, मुनमुन के नाम है मुनमुन के।
देखो अब टंका नीचे वाला ही है। हाँ, right. See how you correct SPJ first here. And now you see how I have trained my physiotherapist in 1 month.
Centrifugal with 4,000 RPM, 4,000 and 8 tubes. RPM and 8 tubes. Yeah, and for most of if it is AC now, then it is better. Well and good AC. Yes. 15 level. Yes. Yes.
गाओ गाना।
Air condition. Yes.
मुनमुन के ना दे एक मुनमुन के,
How much is the cost?
मुनमुन के नाम मुनमुन के।
Okay. She is taking away.